I almost didn't come in today because I'm sick, not in a contagious way, but in like a shitting my brains out way. Again, clearly there's something wrong with my body, and I don't know what it is, but it is vile, and I hate myself, and I'm repulsed by myself. And there's a high probability that I might have to run to the bathroom during this show. I risked a lot. I want you guys to know, coming here, driving here, I risked everything. Wow. I could have easily been shitting on someone's lawn. It could have gone either way, man. So I'm planning on doing a shorter episode today. Thank you guys. Thank you. I appreciate that. Thank you, everybody. All right. No. Thank you. Thank you. No. Sit down. Thank you, guys. Thank you. Yeah, so I'm going to do a shorter show today, probably. I just want to get to all the fun stories, and I couldn't leave you guys hanging, you know what I mean? I do have a colonoscopy planned, which is coming up, actually. And it's an interesting timing. Whoever scheduled this fucking is anti-Semitic, and I'll tell you why. Let me tell you why. My colonoscopy is on May 28th. Okay? You know what's the day before that? Memorial Day. You know what you do on Memorial Day? You eat all kinds of good shit. You cook steak, you eat hamburgers, you eat hot dogs. You know what you can't do the day before colonoscopy? Eat. Oh, what the fuck, dude? That's un-American.
Just eat anyways.
Why would... Oh, good. True.
Fuck 'em. It's just gonna...
True. It's on them.
Yeah.
Yo, if you gotta wade through shit...
Yeah, who cares?
To give me my colonoscopy, that's on you, buddy.
You choose that fucking profession.
You know,
like... American.
I'm just being real here. Like, have some respect for our veterans, man. Of which some were surely Jewish, which makes you anti-Semitic and anti-American. Chew on that, scumbags. Yeah, that sucks, but it's coming up.
Right before you go out, you can just say, I got a surprise for you. And then you just
You'll see.
sleep.
You'll see.
You'll see.
That probably does happen, and they're like, oh, this dude's been eating.
Yeah, for
and they
sure.
have to call it off because there's shit everywhere.
Un-American.
Oh, maybe. I don't know.
For sure it does. But you can't eat for a whole 24 hours, man. And I've been losing weight since this has been happening to me. Like, I lost like 5 pounds since I started having this a couple of days ago. It's just not good, man. It's not good. It usually, it lasts for a few days and then it gets better. But it's been happening more frequently. Before, it used to happen like once in a blue moon, like once every year or more. And now it seems to be happening like once every month or 2 months or something. And I don't know what's causing it. And what's scary is I don't know if it's bread. I don't know if it's dairy. I don't know if it's something else. And so like I'm afraid to eat anything. To go have some toast. Because I can't eat toast. That might come back and get me. It might be fried food. The day before it happened, I was eating schnitzel that Ila's mom prepared.
Oh, that's good.
Well, it's not like super fried, but it is fried. The time before we had it was also fried food a month before. So that's something I've noticed. But I've also done a test for celiacs and I was negative.
That's a 10.
Recently. Brother. You know, my mom has colitis and all. She's just totally dysfunctional. So I'm afraid I'm coming apart at the seams here, people. Oops. And I hope, thank you, Zach. And I hope that Jakey Lakey, the Flaky, whatever his name is.
No. Dr. Doolittle.
Dr. Doolittle. His name is Jakey, right?
Jake Doolittle.
Dr. Do Better. Hey, Dr. Do Better.
Hey, man, I have no idea what you said about me.
Why? Okay, this is how fucked I am. I just opened H3H3 Productions. Mm-hmm. The channel. Meant to go to H3 Podcast, the channel, so I could read the chat.
Right.
Chew on that. Thank you guys. Yeah, so thank you, Dan. I recently did a full body CAT scan, ultrasound. What was it?
Didn't you do an MRI?
MRI.
Oh, MRI. Yeah. And it's actually really interesting. You guys want to go over the results? I got a full body details.
Really?
That sounds
Let's
great.
see.
It's pretty
Let's
cool.
see it.
It's like a preventative.
Are you an android?
Well, I
Are
didn't.
you
I didn't
made of
explode
flesh
in it.
and blood?
I did not explode inside of the machine. Do you have my results, Lena?
No, I don't. I can get them for you if you want.
It's in my. I can pull them up. I'll send them to Dan. There's actually really interesting stuff in there. Luckily, I don't have any tumors. You know, it's a dub. That they could see anyway. You know. It's called. Maybe I won't say the name of the place. People will be weird about that. Probably find my. Well, you don't have to worry about finding it. I'm gonna tell you everything right now.
Was this just a elective
Yes.
MRI?
Yeah.
See what's up?
There's just been a lot of weird shit going on in my body.
Yeah.
And it seemed like a good idea.
I guess why not, right?
Yeah, it's definitely an elective thing though. Okay, so oh shit. I think I gotta log in to do this.
God.
It's worth it though. It's really cool. Oh fuck. Is it worth it? I don't know.
I don't know, man.
Kind of.
I really don't know.
Sounds interesting.
No,
It is interesting,
Ethan.
but I'm getting. Doctor, do better. Shut your fucking mouth.
Well, fuck.
I shit out foam last night, bitch. Yeah,
That's new.
it looked like a fucking freshly cracked root beer, bitch.
What?
How dare you talk to
Wait,
me, Doctor Do Better, you
that's
fucking
the new one.
scumbag. You bitch.
I wonder what that means.
Foamy poop.
Did I ever get an apology like that? I don't know what I am talking about, and I'm wrong. Did he ever actually say that, or did he just bitch out? And frankly, ever since he called me out, my conditions worsened. So I think maybe it's even on him. This great stress he caused me.
Malabsorption disorder, when the body cannot effectively absorb or use nutrients in food. This is one of the potential.
That could explain my
And then they do-
death-like state.
They mentioned celiac disease is a form of that. So, which you said you don't have.
They tested me; it was negative.
Huh. Well,
Sorry
foamy stool.
Sorry about that powerful image, guys. Somebody says, "Yup, ulcerative colitis," like there for sure. Well, okay, hold on. I don't know if ulcerative
Oh, here we go.
colitis. I mean, again, my mom has it.
It also says that babies sometimes have foamy poop. Is it possible that you're a big giant baby?
Maybe it's contagious.
Is it possible?
Being a baby
This
is
is the big baby.
Let's see, ulcerative colitis symptoms. Pain in the abdomen and cramping. That doesn't really happen. I mean, it happens when I'm like having diarrhea, but that seems normal. A gurgling or splashing sound heard over the intestine.
Gurgling.
I've had lots of gurgling.
Okay.
Like when I stood up in the middle of the night to go to the bathroom, it was like tons of
Jesus.
shit. Like transferring from my stomach. It was crazy. I don't have a fever. I mean,
Are you?
Oh,
do you
that was
have?
horrific,
Are you
dude.
okay here?
am I okay?
Yeah. Do you feel okay?
No.
Well, let's wrap it up.
Yeah.
No, but I wanted to come for the
Well,
people.
no, for about 10 minutes.
You know, this is important. What we do here is important, you guys.
Right, it's true.
It is.
And we have to do our ads.
If I can come in and do a couple hours, that is not what I did not know how many ads we had. We just so happened to have 3, which is great. But I did not know that. I diagnosed you with big baby syndrome, Fizzy Cat said. I don't get fevers. Feeling that you need to pass stool even though your bowels are already empty. I mean, that's kind of a diarrhea thing. I've been.
Sounds like
Yeah, weight loss.
diarrhea.
I don't know. It's not. This is it. It doesn't seem
you
that
definitely
serious.
have that. That chatter said it's definitely this. So
This is all though
Sorry.
ulcerative colitis. I thought it was more serious. They're just
Well,
like, yeah, you
maybe
have
go past-
diarrhea and your stomach gurgles.
Maybe click past the bullet points on the Google result.
Okay, good idea. Pen medicine. That's it. Other symptoms may occur. Joint pain? No. Mouth sores? No.
Okay.
Nausea and vomiting? No. Skin lumps or ulcers? No.
Well, congratulations, you're cured.
Well, they find out with the colonoscopy, so luckily I'm about to find out pretty soon here.
Sigmoidoscopy? Sigmoid?
They're going to do... Oh, are they going to do...
Sigmoid?
What are you reading?
The name of
end of the
sigmoidoscopy.
That's where the...
Sigmoidoscopy.
What the sigma?
That's where we peek into, and we call it off.
You're going to need that because you're a Sigma male.
They don't go all the way in? Yeah.
It looks like enough in.
No, they do the whole length of the colon.
How in do you want?
I want a thorough exam,
I
man.
want it coming out of my throat.
From behind.
I want to go.
This was my ass.
This is the doctor's. That's what he says
This was my
when he
hair.
climbs in there with his instruments.
Then I want you inside of me.
Yeah. So if it is this, we'll find out. You know, I'll be honest. It feels mostly. I feel it in my stomach more than like my asshole with the weird burping I get. It's so
I
vile.
can't wait to put it on you.
I'm such a disgusting fucking weirdo, you guys.
All right, come on.
Thank God that I'm.
Don't be so hard.
Thank God I'm not single. Can you imagine if I was dating and I was out here talking about all this stuff? I probably wouldn't. And then the show wouldn't really be as good.
True.
You know? I'd be like, hey, you want to go out? Actually, I was watching Monday's show and all that talk about colonoscopies and foamy shits and freshly cracked root beers. I'm going to have to pass. Thank you. Thank you. I'm a fan, though. I like the show, but no. Ulcerative colitis is super painful, someone said. It's not painful. It's just horrible. My mom has it, and she goes through really tough times. I mean, I don't think she would mind me saying this. She shits blood. I don't do that.
I don't think she'd mind.
Although, no. You want to call and ask? I'll call her. Maybe she's doing mahjong
Well, I
again.
might get a message in the next few minutes is why I say that.
Nah, my mom is very open with her medical stuff.
Fair enough.
It's the blood of God.
Gallbladder issues happen. Why are you guys coming after my gallbladder? What is
You
this?
shouldn't stress about it. You're doing the right steps. You're getting the colonoscopy.
Gallbladder
Talk to your doctor.
failure
So,
symptoms. But you can remove the gallbladder, right? You don't need that. Jaundice? My skin ain't yellow, bitch. Dark urine? Nope. Rapid heartbeat? Nope. Blood pressure drop? Nope. Why? There's literally no overlap. Why were you coming after my gallbladder? Nate says his wife got her gallbladder removed last year. She was in so much pain. She's okay now? Dude, again, y'all want to talk about like, oh, God made humans and he made us perfect. Why the fuck did Nate's wife get the gallbladder removed then? And like, also, you don't even need it. It's just a liability.
I don't know if it's fair to say that you don't need it at all.
It's gone. I don't think you need it. You need a
you won't
gallbladder?
immediately die without it, but I think there are consequences.
You don't need a gallbladder. Boom.
Come get it.
The gallbladder is a small pouch-like organ in the upper right part of your tummy. It stores bile, a fluid produced by the liver that helps break down fatty foods. You don't need a gallbladder. So surgery to take it out is often recommended if you develop any problems with it. Boom. Bye-bye.
So where do you get your bile from?
They'll make it somewhere else. You think the gallbladder is the only place that happens?
I said
That
no
bile
pickles.
is generated?
Yeah.
I guess I did think that, yeah.
Yeah, I don't know what I'm talking about. But it says you don't need it.
It'll release bile directly into the small intestine.
There you go. It's a bullshit organ.
Same
with, we have two kidneys. My son Bruce was born with one functioning kidney.
Right.
He's fine.
Right.
You know.
But you need a kidney, but that's why there's redundancy.
You need a kidney.
But, you know, you have
do
one
need,
gallbladder.
you do really, really need a kidney.
Right, yeah.
I learned.
Yeah. Gallbladder, however, I'm fairly
Tonsils
convinced.
you don't need? Why are those there?
Without it, it causes diarrhea, fatty food intolerance, gas, heartburn, nausea, vomiting,
Jesus,
jaundice.
chill out on Nate's wife. Why are you going after her?
It sounded more like your symptoms. It sounds like you need your
Yeah, you're
gallbladder.
right. Maybe my gallbladder was removed.
Maybe. Without
Is she
knowing.
having diarrhea, Nate, since it got removed, or is she totally fine? She's
fine.
fine, he says.
Okay, I mean, so I'm convinced. No gallbladder. You want to like?
You don't need it.
Do like an H3 special where we all go have elective gallbladder removal surgery.
Listen to this. This is from a medical website. Contrary to popular belief, you can live normally without a gallbladder. Without your
Believe I've
gallbladder,
fallen
your
into
liver,
popular belief once again.
your liver will release bile directly into the small intestine. This allows your body to digest most foods normally. Bada bing, bada boom. Bob is your fucking uncle.
Okay, well, great.
But that's what I'm saying, you know. And
Yeah,
if there's
the
a, if
appendix
there's
too, which is the other one that you don't really
Which one?
need theoretically, your appendix.
what is
people get-
what even is that? A finger? Stop! Get out of my body.
Stick your finger.
Such a pointless thing.
Get out of
Stick
Also-
your
Out
finger
of
there.
Can I ask you a question?
It is
Why is
finger
it
shaped? Huh? I did not know that off the top of my head.
if
Maybe I
there's
knew
an
that one.
intelligent creator, tell me why is it that AB chokes on steak? And I'll expand on that. Why is the nose and the mouth share the same air system? That is a terrible design.
Flaw.
Is it?
If you choke on food and then you can't breathe, that's a horrible design. That makes no sense. They should have separate airways.
Because
Well, it is separate, but at some point it would need to combine, right?
Why?
I guess just go all the way down to the lungs.
Yeah, two separate entrances to the lungs.
Nose pipe, mouth pipe.
You know, God
I
was
guess,
like,
yeah,
like
that
people
would be
choke to
better.
death. Why?
Because I was gonna say
God's lazy.
It is kind of redundancy, but since they all funnel into the same point, it's one point of failure. You're kind of right.
It's a 1 point of failure situation, exactly.
Fuck, dude.
So, just saying. What's up with that? The fucking banana, atheist nightmare. All right, what are we doing here?
I don't know. We were talking about your bowels and your MRI.
Oh, I
is
wanted
the
to look at
MRI
my-
happening? Are we getting the data?
All right, Lena, let me tell you how to log. Or fuck. How do I do this? All right, let me try to log in here. Hold on.
Oh boy. Incoming entire medical record docs.
It's just the MRI.
Oh, thank you, Nate. Very nice. Lovely.
Wow.
Oh,
we
Nate,
need
you're
this.
you're really
You're really catching on.
yeah, man.
You're really catching on to how boring the show is and how you need something to keep people stimulated.
I could watch this for 5 years.
I'm
Ooh,
squinch-
that one was
Yeah.
sick. What?
Oh my god.
Yo.
It's inverted.
Oh,
We call
okay,
for
it is
inverted.
inverted. I was
It's
just
fake.
wondering that. Whoa. It's fine.
No, it's bullshit.
It's not bullshit.
All right, I got it.
It's
I'm
a
in.
This one is rewinded.
Yeah.
fucking dumb.
Ooh. You don't
I'm
like
in.
that?
No,
I like how experimental they're getting.
Is this me?
Wait. button.
Yeah. Why?
I don't know. I don't. What?
No, this is my report. Yes. Yeah.
What?
Is this me? I guess that's me.
Oh, that's pictures of your insides?
Yeah.
Are you okay? You're totally certain there's no private information.
I mean, private in what way?
I mean, I guess it's extremely private, isn't it?
This is my shit. You guys.
That
wanna
is your brain. Are we looking at your brain
Yeah,
right now?
yeah.
We're gonna see your
Holy
balls.
shit.
Are your balls going to come up?
Yeah, I mean that is a good question.
Oh
actually.
shit! There's a worm in there. There's a little RFK joke, which we'll talk about.
That's crazy. That's just you
Whoa.
showing.
I haven't looked at this because I looked at my cell phone.
Yeah, that's you. Right there.
Wait,
you?
switch
Tell
off.
me
Switch off. Switch off.
I think so. Is it me? I mean, I was laying down.
Dude, I'm going to laugh when we can see your Zabuda.
I'm pretty sure we can see your balls down there.
You can. I'm
Yeah,
looking.
in the top right picture. That's the black things are your testicles.
Slow, hang low, sweet chariots. Head view. Head. I mean, yeah, this doesn't say much to me. They obviously broke it down in a.
Don't worry. Don't worry.
Oh God, this is my prostate. That's what I was afraid it was.
Don't worry. The audience will definitely break this down. Give us a good detail.
You guys want to see starting my OnlyFans
That
now?
was so funny.
Hello.
Is that your crack on the bottom growing?
I'm assuming that that's my ass crack. Yeah.
I think that's your ass crack.
Let's see what else. Tumor detection? I do not have a tumor, by the way.
I need like the ability to throw up an overlay of the image of your spinning body.
Yeah.
The funniest shit I've ever seen.
Wait, I don't know if these are
Wow.
actually me. I'm confused.
Yeah, maybe it's just some random.
It
person.
could just be a random person that they're using for demonstration purposes, but I like. Wait, go back down. Go back.
But it
down.
says images. I mean, what the fuck?
I think maybe this is it.
Yeah, this has got to be it.
Got your
So anyway, let me go to the
everything?
reports.
I think that's you.
All right, so in the nervous
Holy
system, first of all, we had no major
Nate,
findings.
do me a favor. Switch off while he's like opening. new
No, it's
things.
fine. It's fine. Don't.
Oh my god.
It's fine, Nate. That
That's
is
not
not
you.
me. So here we had 2 minor findings in the nervous system. Let's take a look. In the brain, you guys will be happy to know that
Your brain is.
I have a
top shape.
white spot on my brain right here.
Oh, I see it.
What does it mean?
That's concerning.
Apparently not a lot. It says no action is necessary. Can be reassessed. Oh, brother, I don't want to reassess that. No, it says, let's see. There are bilateral lesions located in your brain. Very few foci of white matter flare signal abnormality, likely age-related and of no clinical significance.
Thank God.
You're just getting old. That's it.
You got white spots, buddy.
Got some spots on the brain.
And then so there's that. That one made me a little nervous, even though they say it's of no clinical significance. I'm like, don't like white spots in my brain.
Bilateral lesions.
Yeah, well, a lesion on my brain. What does that mean? Need some chapstick in there?
I mean, doesn't that happen from bonking your head? It could have just been at some time in your life where you bonked
It
your head.
says, yeah, it says, well, it says this finding is relatively common in people over the age 30, and the number of spots can increase slowly, if at all, while aging. These are generally asymptomatic, although in some people there's a slight correlation to migraines, which I don't have. The exact cause of these cannot be determined, but they may be related to changes in small blood vessels in the white matter of the brain, or they can be from an old injury, as Dan correctly pointed out.
Well, there you go. It's just wear and tear. That's what they call wear and tear in the industry.
And damn. We also have one additional clinical observation about the brain. What do we got here? Normal MRI appearance of the intracranial astrial vasculature. Vasculature.
Okay.
That doesn't
I
mean
don't know
anything.
what that
Hold on.
means.
What the fuck?
Intercranial arterial so just your blood vessels in your brain, basically.
How is that an observation? So nothing? They
They're
observed
saying it's normal.
addition. How's that?
So that's good. That's good news.
Okay.
You got blood in your brain.
Okay, great.
want that.
We love that. So the brain is looking good, except for just one little minor scratch, one dent,
Right.
which is, the brain is important. We like that.
You can suction that right out.
Now we go to respiratory system. Let's take a look here. 2 minor findings. This one was real interesting. Sinus. I have a deviated septum.
Hell
Yo.
yeah. Welcome to the
I
squad.
never knew that. Look at my shit. It's all fucked.
You
Oh,
fucking
shit, yeah.
you deviant.
Although my nose is fucking massive.
But I don't have any breathing problems. I never have.
Because you're used to it.
It says minimal rightward deviation of the nostril septum. No contact on the lateral nasal wall or inferior tubinate.
Turbinate.
Tubinate, bro. No action required. If you have difficulty breathing, discuss this with your doctor. No clinical significance. Deviated. Mucus retention? Cyst? Oh, brother.
Oh boy.
Oh, I don't know if I saw this one.
Cyst, dude. Nasty.
So wait, where is this? We detected multiple lesions which are consistent with mucus retention cysts.
Where's the mucus?
Oh, it's in my sinus. We detected bilateral lesions in your maxillary sinuses. Mucus retention cysts in the bilateral maxillary sinus. The remaining paranasal sinuses are clear. Most commonly, these are of no concern unless they become larger, oh brother, and cause discomfort. This is a benign finding. If you are asymptomatic, then this finding can be reassessed on your next visit. There it is. I got some fucking But listen to my nasal ways are clean. One left.
I mean, you can still breathe through them, but your voice would probably change a little bit.
Sounds a little restricted to me.
Is yours totally unrestricted?
I have no idea. I haven't had an MRI.
No, but when you breathe.
No, my nose sucks. I probably do have a deviated septum or something.
Does anybody here have totally unrestricted, clear nasal passages?
I mean, I got the surgery for deviated
same.
septum, but I still have problems breathing sometimes.
Because, like, I don't know.
I guess for the most part, I feel fine. I say that I have a bad nose because I've gotten a lot of sinus infections in my life, but I guess that could be a totally unrelated thing.
So we've got circulatory system. What do we got here? We got spleen issues. That's another one you can get rid of, isn't it? Hold on.
Yeah.
Well, now I'm doubting everything.
Do you
I thought
need a
your
spleen?
gallbladder.
Like, how many of our organs can you actually even need? Spleen is a fist-sized organ in the upper left side of your abdomen next to your stomach behind your left rib. It's an important part of your immune system, but you can survive without it. Boom. Bob's your uncle.
Well,
because the liver can take over many of the spleen's functions. Kobe, bye spleen.
Many?
Isn't it pretty amazing that it does that?
The liver's badass. Yeah.
No, I mean, you could argue the opposite. If you're saying, what's the proof of God? But you could survive without it. It's kind of amazing.
I mean, and yeah, the spleen one isn't as good of an example as the gallbladder. It's not, because it does say that it has an important function. Yes, it can be taken over by another organ, but that's just
it's proof
redundancy,
of,
like AB was saying.
Hold on. It's proof of evolution, which is the antithesis of intelligent design. You know, because if people's spleens go out over the course of millions of years, those ones with the livers that can cut it are the ones that survive. So yes, it is incredible. You know what's incredible? The banana.
Why?
It's the atheist nightmare.
Wow.
Let me tell you about banana.
It's a nightmare.
What's up with my spleen? Let's see. Accessory. I have an accessory spleen. The fuck?
Yo, you got an extra?
You got a
Now
big spleen, bro.
We detected findings which are consistent with an accessory spleen.
Yo, you have two spleens.
Is that what? Well, hold on. Okay.
Yes.
This splenule measured 0.8 centimeters in diameter. Incidental note of a small accessory spleen, which could be congenial or related to prior trauma and is of no clinical significance. Okay. I've got a hitchhiker.
You have two spleens, my dude.
Extra large and extra hard.
It doesn't exactly seem like that's what it means. But, all right.
That's fucking cool.
Also, they have another one here. Spleen appearance. No assessment.
Not been assessed.
Oh, they didn't do it?
We have no idea.
Yo, what the fuck? You guys didn't look at my
knowing.
spleen appearance?
You got to go back.
Shh. All right, so my circular system's cool. Endocrine system is weird gravy there. That's like hormones, right? Thyroid, adrenals, check.
Sick.
Look at that. Look at all those green check marks.
Bro,
Killing
you
it.
got all the achievements.
Bro, for real. Urinary system. This
Might
one
wanna
was weird.
Skip this one.
No.
Well, just for okay.
No.
It's just it's an MRI image.
I wasn't sure what was gonna pop up on this.
It's not actually my dick and balls.
Almost.
Yeah.
It looks
close.
I mean, it's not like, you know. Okay,
Fair
yeah.
enough.
Show me.
You're good.
Which part of this is like a Ken doll?
I know.
It's
all
not
good.
me, by
I just
the
didn't
way.
know what was gonna be in there when you.
That is not me.
No,
for the
that's
record.
you.
Understood.
So there was a really weird thing here. It's of no adverse findings, but check this out. I always wait, where's the Oh, I guess wait, there's
Said
nothing
no
wrong
adverse
here.
findings.
Is
Oh, no,
it in the
no.
reproductive?
Never mind, yeah. The urinary system is A-OK, baby. I meant to go to the urinary system, which has no verse. No, the reproductive system, that's where I need to go. Thank you, Zach. The prostate. Now,
Okay,
this is interesting. I am a frequent peer. I wake up in the night to pee. I hate it. And I always was like, I must have a big prostate or something. Well, in fact,
Can we?
What do you mean? Can we show this? It's literally. It's a fucking medical imagery,
Okay,
bro.
then it's fine.
It's not even me.
It's
I get it.
educational.
I said no pickles.
You know what I mean? Like, goddamn, if I can't show this, where are we?
Okay, fair enough.
That is very vulgar.
I mean, ISIS has videos on YouTube, and I can't show this.
Got some nice balls, dude.
These are not mine. This is not my body.
Wait, what?
This is not my body.
I think it's your ball.
No, it says this video is for educational purpose only.
Got it.
Oh, it says that too. Yeah.
Okay.
GG.
This is not my dick. This is not my balls.
Kind of breaks the illusion, though.
Calm down. All right, total size of prostate. So here, this one kind of surprised me.
I'm Dick Jeff.
That one's my yeah. I don't even know what the fuck I'm looking at. What's the problem?
You're fine. No,
That's vulgar,
that's
bro.
fine. I have no idea what we're looking at either.
It's just a prostate, brother.
Yeah, that looks big though.
So right, it looks big. I was like, oh shit. Hold on, hold the phone. Your prostate volume was calculated at 21.9.
Oh, you have a small prostate.
I have a small prostate.
21.
Okay.
The usual size is 30.
Huh. So you're good.
30 or
Gucci
less.
there.
But then I started being like symptoms of small prostate, and that apparently that can cause the things I'm having. So I messaged my doctor. I said, "Yo, I got a small prostate." He's like, "It's nothing." So I said, "All right."
No.
He's like, "I can send you to a urologist if you want." I said, "No, it's fine. If you say it's fine, I'm cool."
I'm sorry, bro.
Sorry about that, though. Cringe. That is not my penis nor my balls.
Yeah.
For the
Artistic
record.
purposes only.
This is literally so educational. Digestive. My bowels are good. My esophagus is good. My gallbladder. We already know about the gallbladder. I got a hitchhiker.
Dusty Gooch.
No, that was the spleen that you had a hitchhiker on.
Let's see what's up with my gallbladder. Normal.
good.
It says normal.
Yeah, that's a
Well,
good
what
looking.
is that?
Why does it say one additional finding? Oh, here. Let me click this. I guess not.
I mean, that's it. It's just saying it's normal.
So overall, I think I'm pretty happy that, things seem to be okay.
Wait, what's wrong with your...
Oh, yeah, I have an issue with my bones or something. It says they're defining shoulders. Guys.
In my bony little back.
I know what a shoulder is. I'm here for the medical information. Thank you. This one. Okay, here
Were
we
they
go.
able to determine some sort of explanation or cause for your wibbly wobbly arms?
They didn't have analysis.
There was
for that.
no analysis for the wibbly wobble?
They detected a bone cyst. Ew. My shoulder.
You got nasal cysts and bone cysts, my dude.
There's a lesion located in the humerus of your right shoulder. There's nothing funny about this. Tiny cysts at the right humeral head in the region of the suprachiasmatic tendon. Insertion could be related to prior injury. Oh, okay. Including exercise-related degenerative change, or could be of no clinical significance. This is a benign condition.
That's cool. Can you feel it?
No. It says correlate for pain and physical exam. I don't feel it. I don't have any pain in my shoulders.
They're lying to you, bro. That's a fucking microchip.
Oh.
I'm in pain. Ouchie.
So I was a little nervous. I was like, "Fuck, bro. I'm afraid of what's gonna pull up." But it seems pretty good actually overall.
Fantastic MRI. One of the best I've ever seen.
Yeah.
Crush that.
What shoulder was it?
Small prostate.
Good job.
Was it your left or your right shoulder?
Good question. Let's see. It says we detected a lesion located on the right shoulder.
Okay. I'm
not quite exactly sure what they're trying to show me with this. Oh, here. Oh, it's very small.
The right?
So it'd be like right.
Wow.
I was just making sure it wasn't this moment I sent you in Discord.
Okay.
Just the right?
Oh, no. This could be a recent injury. That's the left side, though.
Yeah, that's the left.
Yeah, wrong side.
Yeah.
Probably back from my days in youth when I was doing extreme sports and such.
Maybe
High
gaming related.
contact. All right, guys, listen up here. Well, that was fun.
That was a
That
good
was
time.
very fascinating.
If anyone wants to do it, they gave me like a bunch of fat coupons for recommendations, like $200 or $300 off.
Yo, how much is it?
It's a little pricey. It's like $1,000.
Yeah. See, I wouldn't.
A couple $100 off.
That's a significant amount.
So it's like 20-30%
Do you-
off.
Yeah.
It's a good coupon.
That's what I thought too.
Do you get a discount if we go?
No. No.
Buy one, get one free?
Referral code?
No.
They got
I'm
like
not, guys, I'm not scheming here.
I know,
on
I know
the-
you don't.
On the MRI deals.
MRI creator code?
You
No,
think they'd give us a like a little trade, a little shout out on the show?
A little trade, a little this for a little that. I could call them. Maybe they're entrepreneurs.
You know?
I want free MRIs for the whole crew for life.
That'd be fantastic.
That's a good deal.
That'd be kind of good. However, I will say also, there's a, wait, what, Lena? Oh, me and Hila got a couples discount.
Yeah, that's where that came from.
Oh,
I thought it was free.
That's cute.
Interesting.
What, couples date?
Huh. Lena,
How deeply do you think they investigate that? Do you think Love and I could pair up and just like pretend?
I don't think you guys need to be romantic. I think it's just two.
A couple of guys.
Yeah, no, I don't think the romance is a prerequisite.
So you still get a discount if it's just
two
two
get a
dudes.
discount.
But we gotta lay on the same table when they do it.
In
Next to
the
each
same
other.
tube. You have to lay on top of each other.
Right.
They just knock them both out.
I think
lay on
as long
top.
as you guys book together, I don't think they'll ask if you guys have consummated or
Well, they might.
That's why I was
kissed or
curious.
anything.
I mean, that's why I asked.
That'd be annoying.
Yeah.
I think it's really a cool thing though, and it's really great technology what they've got here. They do like such a crazy.
It is pretty wild.
Pretty
They can
cool.
do that.
Yeah. All right, so but here's the real deal, Lena. If you want to contact them, be like, yo, we have the biggest podcast in the world, free MRIs for the whole gang, and we'll plug the fuck out of your shit.
Oh, I'll do that.
That's not
I'd
even
love
a good
to,
deal
yeah.
for me, frankly. Like in terms of like promoting a company, that hard. You know, I'm doing it for you guys. Because y'all need to live as long as possible.
Yeah.
To make, to work here.
yeah. It's a selfish endeavor.
Yeah. I'm curious how that call goes.
That's crazy.
It's a long wait too. It took us how long did it take us to get that appointment, Lena? Big
It was
demand.
a few months, yeah.
Jeez.
Mhm.
Wow.
They're busy.
Yeah.
Busy over there.
And one of the worst
Really? A month?
experiences you can have is sitting in there for an hour. So you look forward to that too.
I've never been to a doctor, so that'd be cool.